This is Dr. Joshua Levine in New York City at the Center for Breast Reconstruction. This is a video about high risk for breast cancer and prophylactic mastectomy. If a patient is at high risk for developing breast cancer, it may be recommended that she undergo a prophylactic mastectomy. Prophylactic mastectomy is the removal of the breasts prior to the development of cancer. Risk for breast cancer is assessed according to the patient's known risk factors and lifetime risk of developing breast cancer in the future. If a patient's risk is significantly high, it may be recommended that she undergo prophylactic mastectomy. Conditions which would result in a recommendation for prophylactic mastectomy usually have to do with the patient's genetics. In other words, if a patient is genetically predisposed to developing breast cancer, then the risk may be high enough to justify the removal of the breasts prior to the development of cancer. A patient may discover that she has a predisposition due to the known family history of breast or ovarian cancer in her family. If there is a high prevalence of breast or ovarian cancer in a patient's family history, it is recommended that the patient undergo gene testing. The patient may receive a diagnosis of a specific gene mutation, for example, the BRCA gene mutation. There are other gene mutations which also predispose a patient to a high risk of breast cancer, such as TP53, PLB2, CHEK2, and ATM, and others. Each one of these mutations carries its own risk profile and should be evaluated in association with the patient's age, personal history and family history, and her candidacy and desire for surgery. Again, prophylactic mastectomy means the removal of the breasts prior to the development of any malignancy. If this is done, there is a dramatic reduction in the patient's risk of developing cancer in the future. But the risk never goes quite down to zero. If a patient decides to undergo prophylactic mastectomy, she should learn as much as possible about the options for breast reconstruction. Breast reconstruction in these patients is indicated in order for the patient to be restored to her normal, natural anatomical condition. The most common type of breast reconstruction is implant reconstruction, but the gold standard is using the patient's own body tissue. This is also called autologous breast reconstruction. This can be done in most women with minimal downtime and provides the patient with the most natural and enduring breast reconstruction. Please refer to my website, centerforbreastreconstruction.com, or my other YouTube videos for a more detailed description of different types of autologous reconstructive options.